Welcome to our channel Nursing Exam Success.
In today's video, we'll practice 20 high-yield Saudi Prometric nursing exam questions with answers. See how many you can answer correctly, and let's begin.
Question 1. A nurse is assessing a newborn 2 hours after birth. The infant's axillary temperature is 36.2 degrees Celsius, 97.2 degrees Fahrenheit. Which nursing action is the priority? Option A. Place the newborn under a radiant warmer. Option B. Give the newborn a bottle feeding. Option C. Bathe the newborn. Option D. Perform a heel stick blood glucose test. Correct answer. Option A. Place the newborn under a radiant warmer. Question 2. A full-term newborn has a respiratory rate of 68 breaths minute, nasal flaring, and intercostal retractions. What is the nurse's priority action? Option A. Swaddle the infant tightly. Option B. Notify the healthcare provider immediately. Option C. Feed the newborn immediately. Option D. Reassess in 4 hours. Correct answer. Option B. Notify the healthcare provider immediately. Question 3. A nurse is caring for a healthy newborn immediately after birth. Which intervention should the nurse perform first? Option A. Measure the newborn's length. Option B. Administer vitamin K. Option C. Dry the newborn thoroughly and provide skin-to-skin contact. Option D. Obtain footprints. Correct answer. Option C. Dry the newborn thoroughly and provide skin-to-skin contact. Question 4. A newborn is 24 hours old and has passed meconium but has not yet voided. Option D. What should the nurse do first? Option A. Restrict feedings. Option B. Notify the healthcare provider immediately. Option C. Insert a urinary catheter. Option D. Continue to monitor and document the finding. Correct answer. Option D. Continue to monitor and document the finding. Question 5. A nurse is assessing a newborn and notes bluish discoloration of the hands and feet, while the trunk remains pink. What is the nurse's best action? Option A. Reassure the parents that this is a normal finding. Option B. Administer oxygen immediately. Option C. Notify the healthcare provider. Option D. Begin chest compressions. Correct answer. Option A. Reassure the parents that this is a normal finding. Question 6. A newborn is breastfeeding for the first time. Which observation indicates effective breastfeeding? Option A. The infant cries continuously during feeding. Option B. The infant falls asleep immediately after latching. Option C. The infant has rhythmic sucking and audible swallowing. Option D. The mother reports severe nipple pain throughout feeding. Correct answer. Option C. The infant has rhythmic sucking and audible swallowing. Question 7. A nurse is assessing the umbilical cord of a newborn before discharge. Which finding requires further evaluation? Option A. Small amount of dried blood at the base. Option B. Dry cord stump with slight darkening. Option C. Cord beginning to separate. Option D. Redness and foul-smelling drainage around the cord. Question 8. A newborn suddenly begins choking and coughing during a feeding. What should the nurse do first? Option A. Continue feeding slowly. Option B. Stop the feeding and assess the airway. Option C. Lay the newborn flat on the bed. Option D. Offer additional formula. Correct answer. Option B. Stop the feeding and assess the airway. Question 9. A nurse is assessing a newborn's reflexes. When the infant's head is briefly allowed to fall backward, the arms extend and then flex inward. Option D. Which reflex is the nurse assessing? Option A. Moro reflex. Option B. Babinski reflex. Option C. Rooting reflex. Option D. Stepping reflex. Correct answer. Option A. Moro reflex. Question 10. A newborn develops jaundice at 12 hours of age. What is the nurse's priority action? Option A. Delay further assessment until 24 hours. Option B. Encourage routine feeding and observe. Option C. Reassure the parents that this is normal. Option D. Notify the healthcare provider immediately. Correct answer. Option D. Notify the healthcare provider immediately. Question 11. A nurse is teaching parents about safe sleep before discharge. Which parent statement indicates correct understanding? Option A. I'll use a pillow to keep my baby comfortable. Option B. I will place my baby on the stomach after feeding. Option C. I will place my baby on the back to sleep. Option D. Soft blankets will help keep my baby warm. Correct answer. Option C. I will place my baby on the back to sleep. Question 12. A nurse is caring for a newborn receiving phototherapy for hyperbilirubinemia. Option A. Which nursing intervention is most important? Option A. Keep the infant fully clothed. Option B. Cover the newborn's eyes during therapy. Option C. Limit feedings during treatment. Option D. Apply lotion to the skin every hour. Correct answer. Option B. Cover the newborn's eyes during therapy. Question 13. A nurse is assessing a newborn's blood glucose after birth. Which infant is at greatest risk for hypoglycemia? Option A. An infant born to a mother with diabetes. Option B. A healthy term infant with a normal birth weight. Option C. An infant born after an uncomplicated labor. Option D. An infant who breastfed within the first hour. Correct answer. Option A. An infant born to a mother with diabetes. Question 14. A nurse is caring for a newborn immediately after circumcision. Which nursing intervention is appropriate? Option A. Delay diaper changes for 12 hours. Option B. Apply talcum powder to the penis. Option C. Assess the site for bleeding with each diaper change. Option D. Clean the site vigorously with soap. Correct answer. Option C. Assess the site for bleeding with each diaper change. Question 15. A newborn suddenly becomes pale and has a weak cry. Which nursing action is the priority? Option A. Feed the newborn formula. Option B. Assess airway, breathing, and circulation immediately. Option C. Swaddle the newborn tightly. Option D. Place the newborn prone. Correct answer. Option B. Assess airway, breathing, and circulation immediately. Question 16. A nurse is assessing a newborn's abdomen. Which finding should be reported immediately? Option A. Abdominal distension with bilious vomiting. Option B. Soft, rounded abdomen. Option C. Audible bowel sounds. Option D. Umbilical cord with 2 arteries and 1 vein. Correct answer. Option A. Abdominal distension with bilious vomiting. Question 17. A mother asks why her newborn is weighed every day during the hospital stay. What is the nurse's best response? Option A. Weight determines hearing ability. Option B. Daily weight determines vaccination schedules. Option C. Weight predicts future height. Option D. Daily weight helps assess hydration and adequate feeding. Correct answer. Option D. Daily weight helps assess hydration and adequate feeding. Question 18. A nurse is caring for a newborn whose mother has tested positive for Group B Streptococcus, GBS. Which newborn finding requires immediate evaluation? Option A. Hiccups after feeding. Option B. Sneezing several times. Option C. Poor feeding and temperature instability. Option D. Acrocyanosis of the hands. Correct answer. Option C. Poor feeding and temperature instability. Question 19. A nurse is assessing a newborn before discharge. Which finding indicates adequate hydration? Option A. No wet diapers during the first week. Option B. 6 or more wet diapers per day after the first few days of life. Option C. Dark urine with crystals every diaper change. Option D. Dry mucous membranes and sunken fontanelle. Correct answer. Option B. 6 or more wet diapers per day after the first few days of life. Question 20. A nurse is preparing a newborn for discharge. Which instruction should be included when teaching parents about car seat safety? Option A. Place the infant in a rear-facing car seat in the back seat. Option B. Hold the infant in your lap during travel. Option C. Place the infant in the front passenger seat. Option D. Turn the car seat forward-facing after 1 month. Correct answer. Option A. Place the infant in a rear-facing car seat in the back seat. Great job completing practice test 3. Let us know your score in the comments below. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more Saudi Prometric nursing exam practice tests. Thanks for watching, and I'll see you in practice test 4.
If you're planning to start your nursing career in the Gulf countries, we're here to help. Dubai Healthcare Consultancy provides professional guidance for nurses applying to Saudi Arabia, the UAE, Dubai, Qatar, Oman, Bahrain, and Kuwait. Our services include data flow verification guidance, document preparation and verification support, licensing exam booking guidance, health authority registration support, exam preparation materials and study resources. If you'd like assistance with your licensing journey, simply contact us on WhatsApp using the number displayed on your screen. Thank you for watching, and we wish you every success in your nursing career.